Hello, everyone, and welcome to another episode of the Happy Practice Podcast. I'm your host, Adam Sierra, and today we are joined by a phenomenal person. We're joined by Sonya Dunbar. Welcome to the show.
Thank you, Adam. I'm excited to be here.
Sonya Dunbar, also known as the Geriatric Toothfairy, is a dental hygienist, speaker, author, and entrepreneur. With more than 3 decades in dental care, she co-owns Mobile Dental Express, which brings vital services to long-term care facilities. And as a Navy veteran pursuing a PhD, she is a fierce advocate for geriatric oral health. Now, she's authored several books, won accolades, and co-founded the National Mobile and Teledentistry Conference, as well as the Denobi Awards.
Yeah.
I'm sure I missed several things, but did I cover the highlights?
You hit the highlights, Adam.
Oh, well, perfect. We've got so much to talk about today, but I kind of want to go, as always, over the origin story, and yours is particularly powerful and impactful. Can you walk us through your background, how you got into this line of work, and how you became the Geriatric Tooth Fairy?
Well, thank you for asking. Well, my background, it goes really, really far back, but it originated with my grandmother. My grandmother helped raise me on the streets of Detroit, Michigan, and she was very influenceable in my life. And I always promised her that I wouldn't put her in long-term care facility. I would never put her in a nursing home, but all of her sicknesses, diabetic, congestive heart failure, she ended up losing her leg to diabetes. I could no longer keep her at home with my small children. And I was forced to put her in a long-term care facility, which really, really hurt me. I didn't want to do that. And I had a lot of guilt behind that. But a lot of times we have to make tough decisions in life, right? And we put her in a long-term care facility, and she wore dentures, and I noticed that the staff wasn't cleaning her dentures. So me being a dental hygienist, I was a young hygienist, had young kids. I would go every morning, every evening, take care of her teeth, take her dentures out, clean them, make sure her room was clean, and put her in bed. And it came to a point one day I was in a room and her roommate said, "Can you clean my teeth? They don't come out like your grandmother's." And I went and looked in her bathroom and she didn't have a toothbrush there. I looked in her drawer. There was no toothbrush there. I went to the desk where the nurses were and I asked them, and they didn't even have a toothbrush, an extra toothbrush in the building. So I went and brought her a toothbrush and I started cleaning her teeth. I started brushing and flossing her teeth. And I was able to capture her smile, and that made me feel good, capturing that smile from someone who would not smile because they weren't happy with their teeth. And my grandma smoked cigarettes, and she always would ask me to bring her cigarettes. And I was like, no, 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 you have an oxygen tank on your chair. I'm not bringing any cigarettes in here. You're going to blow this place up. And so my grandmother, every time I went, I noticed that more people were coming to her room asking me to do something to their dentures or teeth and brush their teeth. So I was buying all these little packages and cleaning people's teeth just on my own time. And one day I went in and my grandmother was not in her room. And I was like, okay, we called her Medea for Mother Dear. I asked her roommate, and their roommate was sitting up in the bed smiling because it was a line of people outside their door in wheelchairs and walkers. It looked like a geriatric parade. And they were lined up outside the door for me. And I was like, "Where's Medea? Where's Mother Dear?" She was like, "She's out in the courtyard." I go out there, she's out there smoking like a train. And I was like, "Medea, where did you get those cigarettes?" And she was like, "Well, I told everybody that my granddaughter was a dental hygienist, and if they gave me 2 cigarettes, you would clean their teeth." And I was like, "Oh, so you were bartering me out." But that was the foundation of me starting to work in long-term care facilities. My grandmother transitioned shortly after that, and I started going into long-term care facilities just free, just volunteering to educate the staff, to do brush people's teeth and clean their dentures. And then if I got hired on in a company to do that and work my way up the chain. And then my husband and I, Joe Dunbar, we opened up our own mobile dental company to provide care. So now we're in multiple states providing care for, we see probably over 500 seniors a week, providing much needed comprehensive dental care where we do dentures, partials, um, extractions. We're in collaboration with several dentists, and we provide the care needed. We do a lot of training for the staff, which is important because they have a high turnover rate, and a lot of them don't understand the importance of oral care. So they're not taking care of their own mouth, they won't take care of anyone else's. So this is what started it. You asked the second question, how did the Geriatric Toothfairy get started? Well, she came on board because I noticed that we're only able to help the seniors that we could put our hands on. So the Geriatric Toothfairy is the voice for those whose voice who has become a whisper. A lot of us don't even know the long-term care facilities in our community. A lot of seniors, their voice is low. No one hears them. So, but my voice is strong and loud. So I'm their advocate. I travel around to nursing homes, to nursing home conferences, hospital conferences, um, any sort of dental conference that I can to talk about the importance of oral care as we age. And that's how the Tooth Fairy got started. And that's how we have the mobile dental going.
That is so powerful and inspiring.
Thank you.
Seeing people that are in our communities that are our parents and grandparents, someone's son and daughter and brother and sister,
Absolutely.
and you're taking care of them and giving them that dignity and quality of life.
That's what it is, dignity. That's what dignity unto death.
How have other people in the industry, as you've spoken about this and as you've educated other people about this, what's been their response?
Wow. Every time I speak about this, even when I speak to students, there's always a handful of people in the audience and it pulls on their heart and they have that calling, they have that light. They have the ability to lift, to ignite, to trailblaze and to execute mobile dentistry, that light. Not everyone carries that light. And that doesn't mean they're a bad person, but not everybody has the desire to go into the hedges and the highways and take care of older people or take care of underserved children or take care of the homeless or the people on drugs. But there's a remnant of people, and those are the ones that I want to hear my voice. Those are the ones that I'm waking up and calling and training them on how to do this. So when I go out and I speak, there's a lot of people in the audience and they feel bad and it touches their heart and they want to volunteer. And that's so good. But there are a group of people who say, yeah, this is what I want to do. Dentists say, I want to take a day a month to go into the community, or I want to send my hygienist in the community, or I'm retired and I want to do this in the community. So there's always a remnant of people that hear this. So those are the ones that I'm speaking to.
Well, and you mentioned several communities there. You mentioned older people. You mentioned homeless people. Mentioned people that may be dealing with substance abuse, right? What is the current state of healthcare for these populations? Let's understand what are some of the underlying issues so we know how, what it is we're looking to solve.
Yeah. Now, what we're looking to solve, and I'll tap one at a time. First of all, the long-term care facilities. We have older people who cannot get out to the dentist. They're in wheelchairs. They need a hoarder to be lifted up into the wheelchair, or hoarder to get into the bed. So those people have a hard time going to the dentist because the dental chairs are bolted down. So you can't take a wheelchair to dental office because they don't have the room for it, or someone that's in a geri chair, they can't sit all the way up. You have a hard time getting them to the dentist. So that problem is we need more dental professionals in the long-term care facilities. We need more dental hygienists and more dentists going into the long-term care facilities and providing the care because the staff just can't do it and they're busy and they don't even get the simple oral care as simple as getting their teeth brushed every day. So a lot of them have ill-fitting dentures, rampant decay. They don't get the oral care that they need. So they have a lot of comorbidities already. And if their mouth isn't healthy, their body isn't healthy. So that's one dynamic that needs to be addressed. Second, we have the kiddos in underserved areas who they're not hygiene literate enough to take their children to the dentist. They don't even have good oral care themselves. And a lot of them don't have insurance or they don't have transportation. So we need the school vans to go to the mobile vans to go to the schools or pop-up dentistry to go to the kiddos and especially in marginalized areas and underserved areas or low income. A lot of areas where kids the areas where kids get like the free lunches and they don't have the money to go to the dentist. So, if several years ago a young boy died from an abscessed tooth in Philadelphia, that should never happen. No child should die from a toothache. And it's 100% curable, but that's one of the number one diseases among children is decay. So that's one area that needs it. And then you have the substance abuse area. There's a lot of people that are on drugs and are homeless, and they need oral care. They're on the trajectory to try to get their life back together. But you have a lot of meth mouth. That drug situation is big in America. So that's something that needs to be addressed. For those people in those public areas, they need oral care. And there's a lot of families that are in homeless shelters. So they need that as well. So those are some of the areas. And then the marginalized areas around the borders where people are coming into America, they need oral care as well. So these are areas that the regular dentist will not go to. These are areas that are designed for mobile dentistry, which is on the front line of dentistry right now. It's no longer just a one-off. Mobile dentistry is leading the trail now and stepping out in dentistry is claiming to stay. So it's so important for us to see mobile dentistry as a vital part of dentistry.
So somebody who's listening to this and they're feeling inspired and they're wanting to go out and make a difference in these communities, in their local community, what advice would you give them on how to get started in outreach to their communities to disadvantaged populations?
Absolutely. First of all, I would tell them to niche down what area they're interested in, whether it's the kiddos, the nursing home, the homeless adults, the substance abuse, whatever that looks like. Niche that down, and then list out all your resources. And if you're a dental hygienist, and if you're in a state where you need the collaboration with the dentist to do this, get you a dentist that's on collaboration with you, and start setting that up. Start getting your resources, whether you're going to do nonprofit or for profit. Start ordering your resources, make some connections with maybe National Mobile Teledentistry Conference or the National Mobile Teledentistry Alliance. Those are good connections that you can get supplies at, because we have a list online there. But the main thing right now is to find out what demographic you want to service. Get aligned with the laws in your state, because dentistry is so broad with every state with laws for dentists and hygienists. So get in line with that and then go forth from there.
What what are some common challenges that you've seen as people try and get into this space? What are some of the difficulties that they encounter?
Some of the major difficulties, like for a hygienist, for me, like in where I live in Florida, Georgia area, we have to be in collaboration with the dentist. So that was the biggest challenge, is getting dentists to want to be in collaboration with the hygienist and to do this type of work. So now we have an abundance of dentists, but that was the biggest challenge. The second biggest challenge was financing. You have to have the finances to get the supplies for this. But the biggest challenge of all was the marketing, because you feel like this, because these people, like long-term care facilities, you have to kind of persuade them to let you come into their long-term care facilities, even though the people need the care. That's not a number one problem for them. Unless someone has a dental problem, dentistry is not a big problem to them. So we have to market to get into the facilities. You have to market to get into the schools. You have to market to get into the Head Start. So that was the biggest challenge, is to get started, to get your foot in the door. And once you're in one, you're good to go. But that first initial start was hard. I mean, we drove back and forth to Georgia for almost a year. Every Thursday, Friday, we went back and forth knocking on nursing home doors to allow us to come in and do a presentation. Even though they needed the care, they're busy. Dentistry is not a major concern to people that are in healthcare right now. And it's always been that way. There's always been a mouth-body disconnect. So we're trying to bridge that now, but it's a challenge.
And you're someone who's gotten incredibly good at the marketing and at the messaging and at the presenting.
Yes.
What, if someone who's struggling specifically with that, what are some tips that you found that were really helpful?
One tip that I found that was really helpful is to be persistent. You know, go for the low-hanging fruits. Like I tell people right now, start going in and just doing free educational courses. Just go in and say, I just want to come in. People always let you come in and do stuff free. So I want to come in and I just want to talk to your staff and educate them about brushing and taking care of people's teeth, why oral care is important, how poor oral care affects diabetes, high blood pressure, high heart disease, everything. I would start out with that. And once you're in the door, then you can learn the key people and who to talk to. And then you can start maneuvering around and find out what dental they have there. One building we got, I was just going in and doing free. And the dental company that was in the building would not do an extraction. And I told the lady, I said, if I can get my dentist here tomorrow, will you give us the contract? She said, yes. Our dentist went the very next day. We got the contract. And a lot of nursing homes have sister buildings. Once we got that one building, we ended up getting all of them. So it's just about being persistent, not giving up. If it's something that you want to do and you're called to do it, just stick with it and do it. But sometimes you got to give a little to get something.
On that note, one of the things that you mentioned was collaborating with other healthcare professionals, whether that's a doctor, a dentist. It really takes a whole ecosystem of people.
A whole ecosystem, yes.
Tell me more about that.
Yes, first of all, as a hygienist in certain states, the hygienists can go out on their own, but certain states you have to have a collaboration with the dentist. And so it was kind of difficult getting the dentist to collaborate with me. And you had to find the right fit. It has to be the right conversation. So once we got the dentist on board and you're in the long-term care facility, I work with the nutritionist, because oftentimes when people have dental problems, they can't eat. So we work with the nutritionist. Oftentimes we work with the nurse practitioner. We work with therapy. So when the dentist is in there, a lot of times we use teledentistry. So we can have the daughter or son on the phone. We have the dentist on the call. We have the nurse practitioner on the call. We have the nutritionist on the call. And all of these people will be on the call when we're diagnosing someone in a facility. So it's a whole ecosystem. You have the family member involved. When you're taking care of an older adult or even a child, you have a whole community involved. And that's where the AI comes in. And in situations like Weave, where we can connect everybody and talk to everybody via text, situations like that work for the small business and mobile dentistry. Is really big for mobile dentistry.
Love that. What motivates you?
The smile that I capture. A lot of older people are really depressed because they've lived in their home over 50 years. And for them to be in a nursing home and they share a room with a total stranger, that breaks their heart. A lot of them are on antidepressants, and you'll be surprised how many actually commit suicide. That's a statistic. A lot of older people in long-term care facilities want to commit suicide, and they're depressed. But if we could do one thing to give them a smile, it's all worth it. I get up in the morning knowing that I'm giving smiles, I'm saving lives. We know that there's connection with gum disease and dementia. We're helping save lives. So that's what motivates me, knowing that my grandmother would be proud of me, knowing that I'm capturing a smile. I'm giving someone a good taste in their mouth and they have xerostomia and they can't taste their food because their tongue is coated. We're giving them the ability to taste food, the quality of life that we're able to give to people, to be able to change lives. That motivates me. That gets me up every morning knowing that what I'm doing makes a difference in someone else. It's not selfish. It's giving back to what someone just gave someone else.
Well, Sonya, I know I've been incredibly inspired, and I know that everyone listening to this has been as well. How can we find you?
You can find me at sonyadunbar.com. I'm on Instagram. It's Geriatric Toothfairy. The LinkedIn is Sonya Dunbar. But I'm all over social media. But the easiest way to find me is sonyadunbar.com. You can't miss it.
Well, Sonya, thank you so much for joining us on the show and sharing your story with us. And thank you to everybody who joined us and is listening. And until next time, stay happy.
Bye for now.
Take care.